Let's go to Toronto, and the biggest city in the province. The mayor of Toronto, Tory, is on with us right now, and he launched a special task force this morning in response to this growing COVID-19 pandemic. And he says that pandemic is having a devastating impact on the city's economy. We've got Tory on the line right now. Let me begin, sir, by asking how you're feeling. I know that you are self-isolated, but not showing any symptoms. Is that correct?
Yes, I'm feeling fine and I have no symptoms. And so that's very good news for me. And also it's allowing me, frankly, to be self-isolated here, to take all kinds of conference calls and interviews in a way that might be better than if I was in the office because I'm not distracted. But I'm sort of just trying to help out here with our medical officer of health and others to make sure we get healthy and stay healthy and then get strong again economically, which I think is hugely important.
Mayor, we just heard the Premier say keeping the public informed is one of the key components of containment and mitigating all the impacts of coronavirus. So I'm really glad that you're on the air with us and taking the time to inform people in this city, in the largest city in Canada. I would like to know what you believe, how you think of some of the comments made by Doug Ford that perhaps the border to the U.S. should be closed to travelers but not to business. Let's start there. What are your thoughts?
I think that's the practical way to deal with it, because what they've been telling us here in Toronto is that the majority of the cases now being identified are coming, in fact, from the United States, also from other countries. Very many of these cases have been imported, in fact, almost all of them. And so I think that one of the solutions to that is to take additional steps, which I gather the Government of Canada is contemplating. We may hear more about that later, to restrict the flow of people into the country, since that's where, other than Canadians, since that's where these cases are coming from, is people coming from outside the country. And for those Canadians who are returning, I think it's time that all of them took very seriously what is now the recommendation of the Public Health Officer of Canada, as well as the one here in Toronto and Ontario, namely that they should self-isolate, as I have done because I was out of the country, so that we can contain the spread of this virus in Toronto and, for that matter, around Canada.
Perhaps I would argue it would be easier for you to self-isolate than somebody who's got two McJobs, if you will, living paycheck to paycheck?
I understand, but I think this is where employers come in. And I've been urging employers throughout this period to say to their employees that they're not going to be harmed. And that's part of what Mr. Ford was announcing today, which is that we're going to provide protection for people. But I would hope the private sector would do that on their own. And as much as it's hard for them to say we're going to pay people and look after them who are self-isolated because of illness, I would think that's the sort of Canadian thing to do. And so I really hope employers won't have to be legislated to do this. They will just decide whether it's because people are sick or because the schools are going to be closed for an extra couple of weeks in Ontario, that they will tell their employees who serve them well that we are going to look after you. And that's part of what then the governments will have to sort out as to how perhaps business could be later compensated for that expense. But it's about how Canadians look after each other and how Canadians support each other, and that includes business. And I think so far so good, but I think it's really going to have to be baked into what we do going forward.
You know what, in the news business as a journalist, I've seen the best of both, or the best and the worst, if you will, the Dickens model. In times, when times get tough, people do check on their neighbors and care about their neighbors, even strangers, but then there are others who loot, and you've seen those things as well. So I don't know, perhaps it does need to be legislated. Can you legislate kindness? I have another question for you, though. This came with response to what was happening in Quebec, and that is that there was going to be a capacity limit on restaurants, et cetera, keeping people, a certain distance, social distance away. Are you in favor of doing that, closing some businesses that perhaps, require social distancing?
Fortunately, the private sector, including in the restaurant business, where it would be much easier for them to stay open, are responding here in Toronto, and I'm sure in other parts of the country, in a way that is commendable, because they are closing themselves or limiting themselves to different hours. And so, yes, I'm in favor of that. I would like to think a lot of that could happen voluntarily, because people in business understand that the best way in which we're going to limit the spread of this virus is to limit the number of places and times and opportunities for people to congregate together. And so we're watching this day by day. I expect you might hear more from us as a city, and it is a big city, so we can cover a lot of territory, in terms of making sure that we indicate our very strong view, backed up, if necessary, by compliance, that people need to stay home. And they need to not go to places where, where they will congregate with one another. And those places need to understand that by closing or severely limiting how they do business, it will help us to contain the spread of this virus, which has to be job one for all of us at the moment, including business, because in the end, we'll get back to a recovery if they act now to help us to contain the spread.
I have one final question for you. I'm doing two things at once here. I'm trying to listen to the World Health Organization. They're giving us their briefing today on the global numbers of coronavirus. And Mayor, here's what the Director General of the WHO says: that everybody who is a possible case must be tested. For a big city like Toronto, do you think that's possible? Do we have the kits? Do we have the health information and the technology to do it?
Do you know what we have? We have the ability through things like the Ontario government's self-assessment tool for people to go on, because what was going on in Toronto to some extent is people with a sniffle or what might otherwise just be a common cold were kind of showing up in an emergency room or somewhere like that asking to be tested. That isn't sustainable because it's putting people into emergency rooms that shouldn't be there and so on. So I would ask that what people should do is use common sense, use the self-assessment tools, talk to the telehealth equivalents across the country, these telephone health services, and determine that they really do have symptoms that are commensurate with the virus, because there were people who had no symptoms coming in and asking to be tested so they could sort of feel better. And I get that. But I think, we have limited resources and limited numbers of people to do this kind of work. I mean, just by definition, you can't have every single Canadian getting tested. So I think people have to use sense, talk to a telehealth, go online and use the self-assessment tool. And I think if that happens, we have the capacity to test the people that really need to be tested.
I want to thank you for your time, and I wish you continued health, Mayor.
Thank you so much. I appreciate that.
Toronto Mayor John Tory.